Some folks, some therapists will get caught in rigid rules like, well, you can't diagnose your partner or family member, or I can't speak about narcissism because I haven't met this person. That only leaves you not only doubting yourself, but perhaps wondering if you're unkind. That's not going to work here. Today, I'd really like to specifically talk about why it's so important that therapists, clinicians, healthcare workers, or anyone working with people in a sort of a mental health capacity be familiar with narcissism and the impacts it has on relationships. One of the biggest criticisms that I have heard from people who are survivors is that they felt that they went to therapy, but the therapist didn't get it and would try to soft pedal the issue, and they felt really unheard and sometimes even re-traumatized. One of the big issues and problems we have is that many graduate programs, if not most, do not have a full semester or full quarter course just on personality disorders. And when they do, the tendency is to focus on sort of the neuroscience of personality disorders rather than the dynamics inherent in these disorders. And then when they do actually focus on the dynamics of the disorder, they very, very, very rarely reflect on how this kind of personality pattern could affect other people. By understanding these patterns, a therapist or mental health person in any realm is able to hear for patterns and then be in a better position to not only devise a treatment plan, but also a case conceptualization that's less likely to blame a survivor for their situation. For example, giving a client feedback on maybe you need to learn communication skills. I can promise you this. A person who is enduring any form of relationship with a narcissist, there is no type of communication on the planet that's going to get through to them. And if a therapist is instructing a person, well, you need to sort of take ownership for your side, or you need to work on communication, many, many survivors who've been enduring these relationships for years or even decades may then retreat completely again, feeling like, oh my gosh, if a mental health person isn't going to get this, nobody's going to get this. There are many ways you can get this information if you never got a graduate class, but I really think it's interesting to me that probably the one issue that a significant proportion of clients bring into therapy, their struggles with high conflict, rigid, antagonistic, difficult, dysregulated personalities, is the one area that a lot of clinicians don't get specific training in. So I do behoove you, if you're working in this space, and especially if you're working with a wide range of clients, it's very important to understand this. It's important to understand this in relationships. It's important to understand how this sort of operates cross-culturally. It's just a great knowledge base to have because it really puts you in a position where you can be there for your clients in a way that will really, really foster their recovery and their growth. What happens if you're gaslighted by someone who is a trusted health professional in your life, like a healthcare provider or your therapist or your life coach? So let's just start with basics to get oriented to this topic. Sadly, subtle gaslighting can be a sloppy form of communication that all of us are guilty of from time to time. When we aren't communicating mindfully, we'll ask those throwaway questions like, are you sure? Even when it's something like we just asked someone, are you hungry? And they said, no, I'm not. And you say, are you sure? If they say they're not hungry, believe them. Gaslighting gets its power and its harm when it is repetitive, and especially when it is used by a person who is in a position of power or trust. In those situations, we are conditioned to believe, or want to believe, and are more likely to give up on our own sense of self-knowing and reality, or to question ourselves. And when this happens over time, we stop trusting ourselves altogether and live in a chronic space of self-doubt and confusion, which leaves anyone far more easy to control because they don't believe in themselves. This can feel very problematic when it is someone in a position who is supposed to be caring for us, like a healthcare provider or a therapist or a coach, because they are supposed to be a trained listener and trained communicator. We as therapists are not supposed to gaslight because we're supposed to be mindful, right? So I have talked about gaslighting by proxy and gaslighting by tribe. Gaslighting by proxy is when someone else brings into doubt and magnifies the confusion being generated by an existing gaslighted relationship, or supports what the gaslighter in your life is doing. For example, you might be talking to someone about a partner or a family member who is gaslighting you or emotionally abusing you and doubting your reality and leaving you confused. And the person you are talking with says to you, I think you're being too sensitive. They aren't that bad. They don't mean anything by it. I think you're exaggerating. I have also talked about gaslighting by tribe, when an entire group may gaslight you. For example, a family collectively denies the abuse that a member of that family experienced. When gaslighting is substantiated by other people, it is 1,000 times worse. Gaslighters and narcissistic people are very clever. They can put forth a really good public face and then gaslight you behind closed doors. You may start feeling and even looking unhinged, but the world sees the calm, cool gaslighter. As a result, their opinion or portrayal of you as being crazy is easier to sell. And they are very good at convincing people, which only gives them one more line of defense, one more fortification. Because if everyone around you is saying they're so great, at some level you believe, I can't be the only one that's wrong, that's arrogant. That's why gaslighting is so insidious. It's not just one person doing this to you. It tends to get a lot of buy-in because we live in a world in which narcissistic individuals are enabled by so many people. But when this gets into spaces like healthcare or therapy, we believe these should be safe sounding boards where we will be heard. It's something that many survivors of narcissistic abuse have endured. It may, for example, be that this happens with a couples therapist, and it is the therapist saying that maybe the non-narcissistic client should cut the narcissistic partner a break because the narcissistic partner is busy at work. And literally, you may find it that the therapist is making excuses for the narcissistic person's behavior, saying, well, maybe they didn't really mean that. Or maybe we can think about this a different way. Maybe you're just taking what they said the wrong way. Or even worse is when a therapist says, maybe you're being too reactive or too sensitive. Yikes. So you tell your therapist or your coach, I'm in this situation. The situation is that my partner not only doesn't listen, but confuses me. They will deny what happened during the day or in the past. They tell me that I'm losing my memory. They keep telling me that I'm exaggerating. I've become so anxious, and I am finding it difficult to cope. And then the therapist will say, well, that sounds like a communication issue. Have you been clear? Or maybe your anxiety is hard for them. Or, are you sure you remember it right? Or any number of responses that are not only invalidating, but double down on the confusion that you are already experiencing. Listen, therapists may be trained, but they are still only human beings. And I ain't saying I get it right every time too. I have no doubt that I've said the wrong thing and maybe even minimized a client's feelings. When it happens, however, consistently, and I have to say there are more than a few therapists and coaches, sadly, who don't actually understand or necessarily even believe in the phenomenon of narcissistic abuse, which makes it tricky. Many therapists believe that everyone is an equal player in a relationship, that it's very important to preserve relationships, and that everyone has to take responsibility. That thinking doesn't always work well. for people in narcissistic relationships. The fact is that's a philosophy I don't ascribe to. I think that having one partner in a relationship that lacks empathy and that is manipulative and grandiose and entitled is very different than the other person in the relationship who is actually just being a human being and wants things like connection and compassion, God forbid. People then say, yeah, my reality was denied by my therapist. I actually felt more upside down about the relationship afterwards, or better yet, in couples therapy, they'll say that their partner won their therapist over with their charm and charisma. By the time it was done, the client would feel like they were going into enemy territory when they went to couples therapy, with the narcissistic partner and the therapist almost seemingly colluded, and with the therapist, again, often being charmed by the narcissistic person's intelligence, credentials, confidence, or just plain old charisma. So people might wonder, what the heck am I supposed to do if my therapist is agreeing with my gaslighting partner? Maybe I am the one who is wrong. I will tell you this, and I would always be grateful if a client would do this with me. Tell them, say, no, that doesn't fit. Listen, I regularly have clients saying, you know what, doc? I don't know. That interpretation doesn't fit. And that's fine. I'm grateful for that. I'm not a psychic. No therapist is a literal mind reader, even though that some, I think, clients out there do have the fantasy that their therapist is a mind reader. We're not. It's our job as therapists to hear you. But if you do have a therapist that's saying, I don't think you're giving him or her or them a chance, or I don't think you're being forgiving, or my favorite is when the therapist insists that you forgive, then it may leave you feeling even worse and vulnerable to even more gaslighting. When therapy feels uncomfortable, especially when you're going through the rigors of a narcissistic relationship, you have got to learn to set boundaries. And sadly, that is why many people are in therapy, to learn boundaries. So it can be difficult to not learn them and then have to set them in that kind of a relationship. But the fact is, you have the right to terminate a therapeutic relationship if it's not working for you and look for a space that is healthier. You, the client, can say, no thanks, this isn't working. You can tell the therapist or coach why you are exiting the therapy, but you do not have to if that doesn't feel comfortable. You do not owe them an explanation. But you have to be an advocate for you. You can protect you. And then at that point, you do take the time and do the due diligence to find a therapist or a coach who actually understands narcissism and narcissistic abuse and trauma in a way that they can support you and be an ally for you as that you go through such a process. Not everyone gets everything. Not all of us are trained to do the same thing or work with clients with every kind of pattern. But if somebody whose job is to hear you and whose job it should be to also understand the finer points of narcissistic abuse, and you don't feel heard, and you feel like your reality is being denied, and you feel even more confused after you leave your therapy sessions, or you feel blamed for the circumstances of relationship, for example, you're asked, well, I don't understand why you didn't leave, then this becomes a painful life lesson of sorts. People in narcissistically abusive relationships have trouble setting boundaries or saying no or leaving relationships. Perhaps gently stepping out of a therapeutic relationship that has recently started could be a way to start building that muscle. Therapy is not a place to feel doubted, and you should not feel that there's a mandate placed on you to make nice, to further enable gaslighting and forgive. We still live in a world that's a little bit too enably, where people just want the neat and tidy happy ending. But that is not how the story goes with narcissistic relationships. Always remember that the narcissist, even though it may seem like that they're getting away with it, they can't steal your reality. Your reality belongs to you. And whether you're gaslighted by your narcissist, whether you're gaslighted by the tribe of people around the narcissist, or whether you're gaslighted by a therapist or a life coach or someone else who's in your life who's supposed to help you with your suffering, you always have the power to take that reality back and own it, and understand that the people who cannot hear you or respectfully hold space for your reality are just simply not good for you. This can also happen in relationships with healthcare providers. Medicine, although maybe it seems a little bit more science-y, is still a lot of guesswork. And especially if you are living with non-specific symptoms that don't always add up. It is possible that your symptoms do not add up to a definitive diagnosis, or the treatment you're prescribed isn't working. And it can feel invalidating to hear, well, you must be feeling better, or you can't be feeling that way, or there's nothing going on. It's all in your head. It would be far more useful, instead of having your frustration and helplessness validated, alternative hypotheses considered, or even someone simply acknowledging the limits of medicine to detect everything or treat everything with precision, just making a note of that. Interestingly, this is a 1-2 punch that survivors of narcissistic abuse often experience. They not only are psychologically shredded from being through gaslighting and all the rest of it, but they also may be experiencing a range of physical symptoms related to the stress of these relationships. In most cases, if the person could just get away from the narcissistic relationship, they would feel better. But instead, what we do is we often poke and prod the survivor, trying to find a viable biological explanations for their headaches, their tensions, their gastrointestinal issues, you name it. Value yourself enough to say, I need to spend my time with people that see me, that validate my reality. They may not always agree with it, and it's okay if your therapist doesn't agree. But they always have the responsibility to validate your reality and help you feel heard and seen. Because goodness knows if you're in any form of relationship with a narcissist, that's certainly one thing that's not happening consistently in your life. It's the nature of toxic relationships. You become invisible and you feel invisible. Therapy is meant to be a brave space, to say scary things, to explore uncomfortable feelings, and to not be judged. The therapist is not an enabler. They aren't going to say you are 100% right and everyone else is wrong. It doesn't work that way. But they are going to hear your reality and reinforce it, and then guide you into a place where you find your own voice and test out other perspectives and respect your emotional state. It's a place of safe exploration. All of us have the right to be seen in all of the spaces in our life, especially in therapy and counseling. My work is focused on getting therapists and coaches trained on narcissism and how these patterns play out in relationships, so the people who are trained to help actually help. It's always difficult when you're recognizing that someone who's supposed to be helping someone may actually be gaslighting them. And part of that is because not everyone understands what gaslighting and toxic relationships are. So if this does happen to you and you're in a situation where you genuinely did not feel heard in some ways, you can fold up and you can say, listen, this isn't working for me, and go find someone who may, you believe, understand your situation more clearly. A question I get all the time is, Dr. Ramani, please help me out to find a therapist who gets narcissistic abuse. So let's turn the paradigm around in this video. In this video, we're going to talk about some signs and red flags that you should pay attention to so you can avoid working with a problematic therapist or life coach when you are seeking help for narcissistic abuse. It is so important to find somebody you work with who is a good match, and so I'm hoping this video is helpful. The email I get all the time, and I've talked about this in various ways on this channel. So many people want to know how to find a good therapist or coach who gets this and can help me through this. More often than not, if you find someone good to work with on this, you know it. You may feel a sense of empathy from them, of being heard. You might even notice the progress that you're making in yourself. Well, here are some red flags that have come up over time that may signify someone who may not get it and may be resulting in more harm than good. Obviously, we know there's a power differential in any kind of therapeutic relationship. You're paying them for something, and they, as a therapist or a coach, are supposed to bring expertise through their education and licensure. Many people, especially survivors of narcissistic abuse, sometimes don't feel like they're allowed to question or walk away from a therapist where red flags are popping up. These may not necessarily even be bad therapists or unskilled therapists, but basically people who may not yet understand the specifics of narcissism and narcissistic abuse, and as such may be applying the wrong template to this group of clients who are experiencing these issues. The things I'm about to talk about are not an exhaustive list, and if you think there's any red flags I missed, please drop them in the comments. So red flag number 1 would be the therapist or the coach keeps using the two-way street model. Lots of relationship therapists fall back on this. Both of you in a relationship are responsible for what happened. Too many relationship therapy models are based on assumptions of equitability in the relationship, which we know is not true in a narcissistic relationship. The idea that these relationships are truly like two people, two-way street, shared responsibility, not so much if one person in the relationship claims to hold a monopoly on all of the reality in the relationship. When you are being gaslighted or manipulated, this idea of you're both responsible or the two-way street, it no longer applies. A therapist who understands narcissistic abuse, who hears your story, will recognize the patterns, and instead of saying, well, what's your part in this, will ask you how you feel and how you're coping with all of this. They'll ask you your history of being in relationships where reality is denied, and allow therapy or coaching to be a place where your reality is valid and not questioned with the implication that somehow you are responsible for your own abuse. Red flag number 2 is if the therapist or coach asks you why you didn't leave. Personally, I believe this is the most disrespectful question a survivor of any form of abuse, domestic abuse, emotional abuse, or narcissistic abuse can be asked, and shows an unawareness on the part of the therapist or coach about how trauma works or how narcissism works. Unfortunately, a lot of the motivational and coaching spaces are a lot of rah, rah, yes you can lead your own destiny, and take back your life and just walk away. Not so fast. A balloon, yes, can rise and float away, but not if it's weighted down. A skilled therapist or coach will understand the patterns, the barriers, the narratives, and act as an empathic guide as you form a decision and grow into radical acceptance, whatever your choice is. To ask you why you didn't leave is shaming and doesn't use the traumatic framework that sort of the trauma-informed framework that we must use to help survivors of narcissistic abuse. And it also doesn't account for the dangerous landscape of post-separation abuse. The fear of that often keeps people in these relationships. Number 3 red flag is when the therapist or coach pushes back when you use terms like narcissism or gaslighting. Survivors are smart. Back when I first started doing this work, nobody really talked about it that much, and now there are hundreds of books and blogs and thousands of sites online and many videos talking about it. Survivors are out there educating themselves. But unless you are going through it, you're not going to be the one looking at the content. The people looking at the content are the people who are experiencing this. A good therapist or coach should never shame a client for self-education or exploration, and instead will respect the client and ask them to share with them, maybe share the information or the books or videos that have been useful, what they've learned about their relationship from this content, and may even say, hey, maybe I should watch this video or read it myself. Many therapists and coaches will say things like, I don't like labels, or you shouldn't diagnose your partner or your family member. Shut it. Therapy is meant to be a safe space where you can use the language and say the things you need without judgment. Red flag number 4 is when you find your patterns are being pathologized and your issues, as it were, are being blamed for why the narcissist is lashing out. Many a therapist or coach has said, ugh, you're so anxious, you're being so mousy. Maybe that's why your partner's having such a hard time with you. Maybe if you relax, their behavior will improve. That's great. Blame the person's fallout of the narcissistic abuse for their narcissistic abuse. A person who understands narcissistic abuse will understand the cluster of symptoms and patterns that we observe in survivors of this kind of abuse. The rumination, the regret, the anxiety, the self-blame, the confusion, the helplessness, the powerlessness, the negative moods, the peacekeeping, the physical and the mental health challenges. And someone who gets it will never view what you're experiencing as the reason for the narcissistic abuse. Red flag number 5 is if a therapist or coach says, I'm really the only one who gets this, or I'm the best at this, or anything else grandiose like that. Believe it or not, some therapists and coaches can be grandiose. They might say things like, I'm the only one who gets this, I'm the best one, what I do works better than anyone else. A good therapist who's trauma-informed, well-educated on narcissistic abuse, who is empathic, where you feel safe and heard, and with whom you feel a good rapport, that's your best therapist for you. Listen, all of us therapists, we have a skill set, but we are replaceable. None of us have all the answers, right? When the therapist or coach makes it sound like they are the be-all, end-all, cure-all, greatest one ever, then that grandiosity definitely needs to be a red flag. Red flag number 6 is when the therapist or coach is over-focusing on forgiveness and bygones being bygones. You know I am not a fan of forgiveness, and least of all forgiving a narcissistic person, especially while you are still in it or coming out of it. This is a personal experience. Forgiveness is a personal experience. Some people never get there, some people do, and one outcome is not better than the other. But therapists and coaches who are over-focused on forgiveness as the only path forward for your own healing are missing the boat on how healing is inherent to you. It's not about letting the narcissistic person off the hook. Healing done right will get you to a place of indifference, of disconnection. And not even everyone doesn't always get there. It really depends on the nature of the narcissistic abuse in the relationship. When forgiveness or idiocy, like let bygones be bygones, comes up, there is a danger of therapy becoming a place of enabling. Red flag number 7 is when the therapist or coach gets so obsessed with, I can't diagnose someone I haven't met. And you end up feeling like you're the one who's being unkind by using this language. Some folks, some therapists will get caught in rigid rules like, well, you can't diagnose your partner or family member, or I can't speak about narcissism because I haven't met this person. That only leaves you not only doubting yourself, but perhaps wondering if you're unkind. That's not going to work here. I'm not going to get into all the thickets on narcissistic personality disorder versus narcissism and on and on. Narcissism is a descriptive term that describes a personality style. And if someone talks to me about someone who lacks empathy and is entitled and arrogant and grandiose and validation seeking and manipulative, I'll say, those patterns definitely sound like narcissism. Okay? Those patterns sound like narcissism. That's not a diagnosis, that's a damned observation. But when a coach or therapist keeps berating you for using labels that are shaming, and that's a shaming experience for you, and it misses the opportunity for education and healing. Number 8 red flag is if they upsell you more and more. One of the reasons I don't like going to my annual dentist visits is the upsell. When I'm in a clinical situation, I don't like being told that you can add this or that for more money. I'm trying to imagine being in a hospital and then I'm in the operating room and being upsold the platinum appendectomy versus the standard model. I truly believe upselling does not belong in any form of clinical care. It's my opinion, I stick by it. When therapists or coaches upsell services that may be beyond your financial reach and make it sound like this is the only path forward, or the best path forward, that can be coercive. In psychology, my profession at least, we have ethical guidelines that require a good faith estimate of what therapy should cost you. It's an estimate, but a therapist may say, listen, if we work together weekly for 6 months and address your most acute issues, it's going to cost this much, or insurance should cover this much. You got to be careful because there are no shortcuts. It's hard work, putting your head down, getting education, doing the work, journaling, and other mindfulness-oriented activities. But this idea of like, if you do it this way or that way and spend all this extra money, it's going to be better. That doesn't really belong in this kind of therapeutic practice. Red flag 9 is something I call proselytizing. Sometimes some therapists and coaches are acolytes of other leaders. These are often spiritual gurus and new age icons. They may even have pictures of these people they follow in their office or on their website. Or they're also maybe therapists and coaches really plugged into traditional organized religion. I am personally, against my bias, I'm a fan of secular therapy where we separate the two. But I want you to be wary of any coach or therapist who's encouraging you to show up to meetings outside of therapy that are related to the person they're a follower of or that are making big metaphysical promises. Therapy is therapy. Therapists may make recommendations as to other professionals like a psychiatrist or nutritionist. They may check in, for example, on how 12-step meetings you're going to are working or on your sobriety. They may suggest group therapy as an adjunct to your therapy, or they may recommend books or videos. But they are not supposed to be spaces suggesting where you show up at some sort of strange spiritual meeting that they're going to be at as well, or that might make time or financial demands on you. Final one, and the tough one is, has the therapist or coach been through it? This last one is tough. Is it important that the therapist or coach has been through it? Listen, I have no history of addiction, but I have worked with many clients living with addiction. I have no history of several other things, but I work with those clients with those histories. I do have a history of narcissistic abuse, and I work with those clients. That said, I have had clients, for example, with histories of addiction, who will stop and say, you know, Dr. Ramani, you don't actually really understand the craving for that first drink in the morning. And I acknowledge I don't. And I also will tell them, I also understand, like, I get it and I hear you. And if it feels safer for you to work with someone who has that lived experience, I get that too. Narcissistic abuse is a funny one because it's still a new area that's still not acknowledged by many practitioners. Again, having been through it definitely can create an empathy and an awareness that leaves a client not feeling crazy. However, I do not believe that a person must have had a history of narcissistic abuse to be able to do good work with the survivor. The therapist simply needs to approach this from a trauma-informed framework, willing to be present and non-judgmental, and be willing to get training or consultation or supervision on narcissistic abuse. Also, not all therapists are ever going to be transparent about their lived experience, so you simply may not know whether or not they've been through it. I know there's red flags here on things you may want to avoid here that I didn't hit, And some of these red flags I listed here, some of them may not stop someone from being a good therapist for you. Maybe the simplest guidance is that if you feel invalidated in therapy, talk about it and bring it up. If the therapist becomes defensive or shaming, then it's time to find someone new. If, however, you're able to work through that impasse, I still think there's a possibility in that therapy. Therapy for narcissistic abuse survivors is so important. People often enter therapy so confused and self-blaming that having someone who gets it and will not double down on the self-blame and self-doubt and confusion is absolutely essential. Even though a lot of survivors don't feel great about their instincts, your instincts are probably really on point. You've just always talked yourself out of them. It's okay if a therapist or coach doesn't feel like a good match. The reason you're in this space is oftentimes because you were not willing to be kind with yourself and listen to yourself. Let this be the place you do. If the therapist's feelings are hurt, then that therapist needs to go do some work on themselves. It's the nature of the game. Not every therapist or coach is an ideal match for a client, but some of these red flags specific to the narcissistic abuse space, pay attention to them and make sure you find a safe space to do this work. So the question we're going to be tackling today is, what type of therapy is best for recovery from narcissistic abuse? A person may feel as though, like, okay, I feel like I get this. I understand narcissism now. I feel like I understand narcissistic abuse, but I don't know how to move forward from the rumination and all the rest of it. This is such an important question. And I agree. At this point, if you've been watching this channel long enough, I got to tell you, most of you basically have the equivalent of a graduate degree in narcissism. You probably know more than a lot of therapists. You know what it is, where it comes from, how it impacts people, what the dynamics look like. You get it. But the bigger question people have, I understand narcissism, I understand narcissistic abuse. The big question is, what do I do about this? As of now, there is no one therapy for narcissistic abuse per se. Now, in my work in this, I've actually developed a model that I've found works really well with individuals who are recovering from narcissistic abuse, and that really any therapist can use. So let's start by taking on what a client needs in therapy, what you need to sort of look for in therapy when you're trying to find a pathway to recover from narcissistic abuse. Number one, you need a therapist who gets it. At this point, lots of therapists as of now don't. And that's in large part because nothing even approximating this is taught in any graduate school or clinical training. It's a relatively new area. Ironically, these issues around difficult relationships and trauma, they've been around since forever. But systematically addressing it from this perspective of focusing on narcissistic abuse is new. And I got to tell you, there's still lots of pushback from the mental health field. There is still a tendency to be critical of a person who shows up to therapy and says that they have experienced narcissistic abuse. More than a few therapists will say, well, you shouldn't diagnose your partner or your family member, and that each person in a relationship is responsible for what is happening, or that, well, we can't really say they're narcissistic because they're not here to share their point of view. So let's just focus on your role in all of these problems. Or the therapist will say something like, well, all marriages are hard. So I'd love to hear from you on that one. Drop a comment. Did any of you ever see a therapist that you felt didn't fully understand narcissism or narcissistic abuse? What was some of the invalidation you may have experienced in therapy? But it's absolutely important, going back to this point, that you need a therapist that understands the dynamics of narcissism and of narcissistic relationships and does not engage in blaming you or pathologizing you when you are describing dynamics such as gaslighting and love bombing and trauma bonding and all the rest of it. Frankly, you shouldn't have to be your therapist's teacher. While a therapist out there, there are many, many therapists out there that don't position themselves as an expert in narcissism or narcissistic abuse. One thing to keep in mind is that therapists who have a background in trauma or trauma-informed practices, they often do understand the critical importance of principles such as validation and avoiding blame. And Such informed therapists understand that these kinds of patterns leave you confused and doubting yourself, and then to give you the time and space you need to make sense of these toxic relationship dynamics, to grieve them, and to figure out what you want to do and how best to cope. Number two, you need a therapist who doesn't get so focused on the theory behind their treatment model, for example, cognitive behavioral therapy, that they do not make space for the unique aspects of narcissistic abuse. As an example, cognitive behavioral therapy is very much focused on teaching a person to change how they think, with the intended effect of then changing how they behave. Now, this may work, and it works well, when the behaviors are solely related to a person's belief. But when you're working in the area of narcissistic abuse, we need a framework around the narcissistic abuse, right? Narcissism is resistant to change. That gaslighting is a very real phenomenon. Because there is a risk of putting the onus on the person who is experiencing the narcissistic abuse to change how they think. So you're going into therapy. The therapist who's doing, for example, cognitive behavioral therapy will want to focus on changing how you think instead of teaching the client that no matter how you think, you experiencing narcissistic abuse, no matter how much you think, that being gaslighted and manipulated feels awful, and there's nothing you can do to change the other person's behavior. There has to be education and contextualizing of narcissistic abuse in any form of therapy before turning solely to principles like you need to change how you think. You can change how you think until forever. That ain't going to stop someone from gaslighting you. Number three, you've got to avoid therapeutic situations where keeping the relationship together is such a strong part of the agenda. Some couples therapists or people who are solely relationship focused or pastorally or religiously informed counselors are very, very invested in the idea that the only desirable outcome, short of it being physically dangerous, is making the relationship work, and that that's the best possible goal. The problem with that is that does not account for the toxic and the unchanging dynamics of a narcissistic relationship and may foster guilt, a sense of failure, and a sense of self-blame. Number four, as I noted above, Number four, as I noted earlier, if you can't find an expert in narcissistic abuse, look for therapists who focus on trauma. Trauma-informed therapists understand how to work with people who have been through a traumatic and fear-inducing and frankly confusing experience from a place of validation, safety, support, and with a full understanding of how trauma affects the nervous system and the person holistically. That perspective can be really, really useful as a part of being treated for narcissistic abuse, and trauma therapists are really on top of ensuring that a person doesn't blame themselves for something that happened to them. Number five, it's important you work with someone who has a wider understanding of grief. Healing from narcissistic abuse is a deep dive into grief, and not how we usually think of grief for the dead, but grief for experiences that have been missed and lost, grief over loss of hope, grief over loss of time, and a therapist using a grief recovery format and on top of that, if they also understand the dynamics of narcissism, that can be really useful. Number six, the nice thing to keep in mind is that the techniques that work with survivors of narcissistic abuse, they are there's a word I'm going to use, we're going to call it trans-theoretical. This framework, a framework that works with clients who are going through narcissistic abuse, can be used by a therapist regardless of whatever their theoretical orientation is. You might find a therapist who's psychodynamic or humanistic or cognitive behavioral or eclectic. It just requires that the therapist understand the natural history of the narcissistic relationship, the rigid and unchanging nature of narcissistic personalities, and other themes like cognitive dissonance and trauma bonding, and the things that happen to a person who has experienced a narcissistic relationship, and to see it in that context. So any therapist can do this work if they're willing to see it for what it is. Number 7, it's important that the therapist be able to work from a culturally informed perspective. To be able to wholly understand narcissistic abuse and what it does to a person does require a therapist who understands the more nuanced issues and the important issues around race, ethnicity, social class, gender, sexual identity, LGBTQ plus identity, religion, nationality, ableism, age, because this stuff matters in understanding what people experience outside of the room, and the cultural barriers and the other barriers that exist to being helped, to being heard, and to getting stuck in these relationship cycles. If a person is already being gaslighted by the world at large, it makes the gaslighting in their individual relationship feel actually a lot worse. Number 8, try to avoid or reconsider a therapist that makes your therapy their story. While I do acknowledge that having been through narcissistic abuse definitely gives a therapist an informed and empathic perspective, every survivor story I've ever heard has been different. For example, things that worked for me and parts of my story, they may not work for you or even be relevant to you. Therapy is your space, your story, your experience. And if they doubt your experience based on theirs, or give you advice based on theirs, or say, well, this is what happened in my story, it may not be such a good fit for you. Their perspective could be useful for a minute, but your therapy is not meant to be a space to sort of share their heroic narcissistic abuse survivor tale or their narrative. You may want to hear it, but beyond that, it's your time. Number 9, just because a therapist describes themselves on a website or someplace else as a narcissistic abuse recovery expert doesn't always necessarily mean they'll be a good fit for you. They may be a good therapist for someone else, but if it doesn't feel good for you, it doesn't feel good for you. It's also a possibility they've called themselves an expert, but they aren't. Right now, we're still working on the credentialing around this. But be sure that in whoever you see for therapy, you feel safe or heard. Because there's a lot of therapists out there who don't call themselves narcissistic abuse experts, and there actually could be a really great fit for you. Other people, like I said, may call themselves this kind of an expert, and you don't really like them. After going through narcissistic abuse, people don't always trust their instincts. Let this be the day, and let this be the process that leads you to starting to trust yours. If a therapy experience doesn't feel good, you have the right to step away and find another therapist. Don't worry about hurting the therapist's feelings. Number 10, consider rounding out therapy with support groups, but choose carefully. Some support groups may not be well moderated, so if the group doesn't feel right or safe, don't ever feel compelled to stick it out. But having safe, good, well-moderated peer spaces and supportive spaces can be useful to your healing and growth and help you kind of derive strength and belonging from recognizing other people have been through this. Number 11, you got to do work between sessions. I am one of many that strongly encourages journaling, list making, rituals, routines, cleaning out toxic folks, reading, getting educated, mindfulness. This is about a change in your whole life. And while therapy is important, the 167 hours or the work between sessions is crucially important as well. I'd love to have you drop a comment. What are some of the things, those of you who are sort of really doing the work to push back on narcissistic abuse, what's the work that you've done between sessions that's helped you? Number 12, be wary of anyone who says they'll snap you back into shape from narcissistic abuse in 6 weeks or some set amount of time. Healing is personal. There is no schedule. It's always a process. Some people take months, some people take years, and that's fine. Number 13, Work with a therapist who helps you identify any other issues that you may be experiencing, such as anxiety, depression, substance use, disordered eating, and then helps you and works with you to manage them alongside the narcissistic abuse patterns that you are experiencing. The narcissistic abuse is interlinked with the other stuff you're going through, and both issues need to be addressed simultaneously. It's not as simple as, oh, once we treat your anxiety, we'll circle back and we'll talk about that narcissistic abuse. Interdependent, have to be dealt with together. Now, ultimately, when it comes to therapy for narcissistic abuse, as of now, again, now it's time for us to start doing the research, but there is no sort of singular model that works best, but a good model includes trauma-informed practices, trust, not being blamed or invalidated by the therapist. For example, if anyone ever asks you the question, why did you stay so long? No. Good therapy includes grief work, education about the patterns of narcissism, specifically as to how they're relevant to your situation, awareness regarding dynamics such as gaslighting and how to fortify and strengthen yourself, techniques to address rumination, awareness about the intersectional and cultural issues that are relevant specifically to you, gender, race, you name it, and awareness of psychosocial issues like domestic violence or elder issues or custody issues, and connection to awareness of resources that could be useful. Your therapist doesn't have to be an expert in this. They just need to know that these are important things to seek out or even get consultation for themselves to help you. This whole world of narcissistic abuse is a complex and evolving space. And I'm telling you this again, as a last thought, I'm going to repeat this. If the therapeutic relationship doesn't feel good, then leave. Not all of us are a perfect match for every client. It's very hard for survivors of narcissistic abuse to value themselves enough to say that a given therapist doesn't feel right. But sometimes it doesn't, and it's important to find someone who works for you. You deserve at least that much. All of this is a process. Most people come out of this wiser, stronger, a bit battle-scarred. But remember what Rumi says about those wounds, right? Those wounds are where the light enters us. So let therapy be a place of self-advocacy for you, of resilience building, of addressing what has harmed and hurt you. Let it be a place that is designed to help you, but never to blame you or shame you. So I hope that you found the answer to a question about therapy in this video. So please give this video a thumbs up if you did. And any other questions you may want to ask, please drop them here if you want them addressed in future videos. Thanks again.